Hi, my name is Nishkala Palachandra, and I'm going to be talking to you about my capstone defense project. This is my poster as a whole, and I'm going to go into more detail about each part. So, like I said, my project is about the implementation of kangaroo care for premature low-weight infants on vital sign stabilization. A quick background was that the objective of this was to learn more about kangaroo care and how specifically OTs can be involved in the care of these fragile preterm neonates in the neonatal intensive care unit, also known as the NICU. So what is kangaroo care? Kangaroo care, or skin-to-skin care, is the method of holding the newborn against the caregiver's bare chest. And the importance of it is that this is a co-occupation that connects really well with the holistic OT ideology. It helps the babies with energy conservation, which is so important in this time. And again, it helps with the infant's physical, emotional, and cognitive development. Therefore, it is linked to reducing the length of hospital stay. And therefore, I asked my PICO question, in premature neonates, is kangaroo care compared to standard care more effective in stabilizing vital signs? And I conducted a systematic review according to Prisma to answer my question. And this is on the right is my Prisma flow chart. So I used two databases, PubMed and CINAHL, to collect articles for my systematic review. And I used key terms such as neonatal and neonatal intensive care, premature, low weight, and kangaroo care to find out the answer. And I collaborated with the help of the librarian Anna to create a search string to plug into the database. And I was found with 1,027 articles. And after removing duplicates, I was left with 778 articles, and me and a fellow peer reviewer screened out the articles, and I was left with 10 articles that met my inclusion criteria, which was that the babies had to be medically stable, they had to be born less than 37 weeks of gestation, they shouldn't have any other medical comorbidities, and the skin-to-skin sessions had to last at least 30 minutes per day. And all the articles were full text articles published in English after the year 2000. And kangaroo care intervention then received a high level of quality of evidence and a grade recommendation of strong plus according to the imprecision and risk of bias. And the key ingredients that I discovered from the articles and literature was number one was the dosing schedule had to be anywhere from 1 to 4 hours to yield the best results. The positioning, like the picture, had to be chest to chest or chest to back to get the same results. And both mothers and fathers can participate in this intervention. And also just proper education had to be given to the families to have effective use of this intervention and proper handling of their baby. So my case report consisted of 4 sessions with a mom and infant, and the baby that was appropriate for my intervention was born at 23 weeks of gestation. The birth weight was 555 grams, which is roughly 1 pound, 2 ounces. And the mom was 37 years old, and she had some complications, which were, of course, the preterm delivery. She had anxiety, depression, smoking, tobacco use, obesity, history of cocaine, history of THC, and a history of abnormal pap smear. And her rupture of membrane, also known as like the water breaking, occurred 12 hours prior to delivery. And it's something to be noted because it can lead to infection if it's a longer amount of time. And the birth was via repeat C-section, and it was uncomplicated. And the reasons to say was the preterm delivery, RDS, also known as respiratory distress syndrome, which is why the baby was initially put on the endotracheal tube. So it was the ET SIM mode, which stands for synchronized intermittent mandatory ventilation. And then eventually the baby, once had more respiratory function, was able to wean down to a NIV-NAVA mode, which is non-invasive ventilator, and NAVA just stands for neurally adjusted ventilator assist. And then some other reasons were the IUDE, the in utero drug exposure, apnea of prematurity, hypoglycemia, temperature regulation disorder, and neonatal anemia. And if you look to the right, you can see how small these babies are. This is just a picture I found online of a 23-week baby. And you can see the size comparison to the hands, how fragile these babies are. This baby's on a CPAP and all these lines and tubes. So you just want to be careful, specifically for my baby, not to accidentally extubate it or pull any of these lines and tubes. So just very, very fragile babies. And these were the outcomes that I measured. So I did pre and post. I examined the temperature, pulse, respiratory rate, SpO2, oxygen saturation, and I found that in all of the sessions, there was an improvement made after Kangaroo Care. So in this one specifically, you can see the respiratory rate improved and the oxygen saturation improved from 88% to 100%. And on the right was my other outcome that I measured, which was the NB1, which is used with babies that are less than 32 weeks. And it stands for neurobehavioral assessment. It's an observational assessment that examines physiological stability, motor control, state control, self-regulation strategies, and respiratory status. And again, with post-intervention, there was improvement. The baby was less fussy and more alert and using more the self-regulatory strategies like suck after the intervention. And like I said, all the sessions showed improvement in the vital signs, along with towards the last session, there was a decrease in the reliance of mechanical ventilation, like I said, which indicates improved respiratory status. So the baby went from the ET tube to a NIV-NAVA, and that one's better because it has less chances of lung injury causing pneumonia for the baby or having any airway damage, and it provides the baby with detecting electrical activity in the diaphragm and matching the breaths rather than just providing mandatory breaths like the ET tube was doing. And there was no adverse effect found. And this was an amazing handout I was able to create with the help of all the therapists, both physical therapists and occupational therapists, who reviewed my findings. So this is how to conduct a standing transfer in the NICU to provide Kangaroo Care. So I discussed what Kangaroo Care was. I discussed why it's important for parents to do the Kangaroo Care and standing transfer. And then I provided step-by-step instruction on how to lift the baby from the isolette, place it on your chest, and then have a seat on the recliner. And the pictures are going to become medically illustrated once they're able to finish up the drawings. But for now, this is a frame of reference. And then finally, I provided the benefits of Kangaroo Care, like how it helps keep the baby warm, how it helps the baby sleep better, and improve breastfeeding. And again, with vital signs, there's an improvement. And then this is an anxiety questionnaire that I created that just finds more information about parents and how they feel about Kangaroo Care training, how they feel about completing this with their baby that are in the NICU that are very fragile. And again, I collected data pre and post to see how they changed. And this is just another example of how to lift up the baby, place it on your chest, and sit, and how to hold the baby in that diagonal position to yield the best results so you can maintain eye contact. And these were all the additional opportunities that I got to do. So I was able to treat over 600 hours in the NICU. I was able to see a variety of conditions like club feet, neonatal absence syndrome, which is alcohol withdrawal, and of course, prematurity. I was able to provide family-centered care to parents and have them be involved in the cares. Especially, I learned so much about infant-driven and cue-based feeding when babies are 33 weeks. And then I was able to use the M trainer to provide real-time therapy, infant massage, and then I was able to attend weekly rounds for both small baby rounds and discharge rounds and provide them with the plan of care. And finally, I was able to complete various CUs like this one. And these are my key references. And thank you again for your time.